Hello and welcome back to Get It Off Your Chest, a What I Wish I Knew guide from girlfriends who have lived, fought, and survived breast cancer. My name is Andy, and I'm proud to be the host of this amazing group of women. Thanks to Bonnie, our mental health expert from our previous episode, we decided that the theme of this episode would be bodyguards, people who are there to support you during the hard times that breast cancer brings. We wanted this to be an open conversation about some of the big things that stand out to survivors when looking back on their time with breast cancer. Joining Amber, Corey, and I are Judy Schwartz, Missy Baxter, and Jackie Helget. We look forward to hearing from them, so let's get started.
Well, I'm Jackie Helget. I am a breast cancer survivor twice. I was diagnosed, the first breast cancer was in 2004, ductal carcinoma. I had a lumpectomy followed with 33 treatments of radiation. And then did the tamoxifen for the 5-year duration. The second time I was diagnosed in 2020 after 16 years. It was a ductal carcinoma, but it was invasive, and so I ended with a double mastectomy with reconstruction and chemotherapy following that. And also taking a cancer medication now for 5 years as well. So yeah, I've had it twice. I am doing well. My last chemo treatment was it was a year. It'll be a year in June 16th. It'll be. So I'm celebrating that in June. I have had great support throughout my whole journey. And so I'm happy to say I'm in a good place now.
I'm Judy Schwartz. I was diagnosed with invasive lobular and ductal carcinoma, one kind in one breast and one kind in the other. That was February 23rd, 2021. In April of 21, I had a bilateral mastectomy and then started on anastrozole in June. In November, just this past November, I had some pec muscles repaired and the implants one wasn't in the right place. It ended up in my armpit. So my implants were replaced with a different, a teddy bear implant, I think it was called. Is that right? Gummy bear. Gummy bear. And they're much more natural feeling. The first ones were really kind of hard and uncomfortable. And I continue on with my medications, and I'm in a much better place today than I was even 6 months ago, Yeah.
That's awesome. Thank you for sharing. I think we'll start with how would you recommend that you talk to family or your friends or your kids after being diagnosed?
It's a hard question.
I'm sure it's different for everyone.
Question. Yes.
No, it's tough. You have to be honest. You have to be straightforward. I prefaced everything with, it's very treatable, but I have breast cancer. And somehow maybe it took a little bit of the scare out of it, rather than saying something like it's terminal, but,
How long did you wait after you were diagnosed to share with family and friends? Did you tell them right away? Did you bring them along on the experience with you, or did you wait until
Joe and I, my husband and I shared everything with him. It was during COVID, so he couldn't make the first appointments with me. It was like, well, as soon as you get out, give me a call, and so you sat there alone, and you saw these masked doctors' faces looking at you like sad puppy dogs, and there's where I was very strong, and I thought, you tell how many people this every day or every month, what's the deal? And they kept saying, are you okay? And I'm saying, yeah, I'm okay, but I'm not sure about you.
You're worried about the doctors.
Well, they just were so quiet and somber looking, and that was kind of weird. So and I kind of knew that it would be that way, because when I had the biopsy by the radiologist, I just said, be straightforward with me. What's it look like to you? And he said, well, it does look like it's cancer. So I kind of was expecting it already. But I appreciated that. It was kind of no holds barred. And that's kind of, I guess, the way I laid it out to my kids, too. Joe and I didn't tell them right away. First it was like, how should we tell them? We've got 6 children. So when you call a family meeting, then it's like, oh, something big is coming down. And you don't really want that either. At the time, 2 of our daughters were living in the cities. So one day I had a dentist appointment and I stopped at one's house on the way and went to my dentist appointment and stopped at the other one's house on the way home. Coming through New Ulm, we have a daughter that lives here also. And then I stopped and told her, and I knew she would be the hardest one. One of the girls is very much like me. It's like, give me the facts, we'll deal with it, it'll be okay. And there was no tears shed at all. Molly, our youngest, it was a little more emotional with her, but she's not one to really fall apart either. Our middle daughter here in New Ulm, that was tough because I knew I'm really close to her, probably because of distance too. We can do things together because we're close by. But we had the waterworks going on then. And I think I told them all the same day because I knew one would get on the phone with the other one. And I told them they couldn't tell their brothers. And maybe that was on about a Wednesday. And then we have 3 sons that work in our farm business with us, and I told all them to stop over that Friday night after work. I said, Dad and I just want to talk to you. But we do that sometimes with business stuff, so I don't think they were too surprised by it. But you feel really guilty when you have 3 grown boys crying at your kitchen table, And it was tough, it really was, but after that was done, it got much better. And then I think I had a surgery the following Monday, so we didn't tell them too far ahead of time. Somehow you just don't want to see that look on their face that you put there.
You didn't put that there. You didn't make the cancer happen, right?
I know, but that's not the way you feel.
Right, but I think that's an important point. And we were talking on a couple of different podcasts that we've done before, who's going to carry the burden of the diagnosis. And so it's very common when you're the patient receiving that you carry that burden. And Bonnie had brought up a really great important point on our last podcast about who is going to be your bodyguard. And I thought that was a really empowering concept. Rather than putting the onus on you, the patient, to be your own bodyguard and protect the family, transferring that to someone else and letting them take care of you and protect you. And I don't think all of us do a very good job at transferring.
Who would you transfer it to?
Well, so this is a great question. Now we're here in this room providing this podcast, so you are the bodyguard for someone else that's coming down the pipe with a new diagnosis, and that's kind of why we've put this together. So what advice would you offer that woman that's starting to go through that process, or how would you help her manage a dynamic that you experienced?
I think I would do the same thing all over again.
Yeah.
The mom in you never wants to see your husband, your children hurt, no matter what the hurt is. You don't want them to scratch their knee, you don't want them to bleed, you don't want them to get cut, you just don't want them to hurt. But there is a lot of guilt that you carry with it. I don't know how to take it away from yourself and have another source to blame, but I don't know, I can't say that there's anything I would do differently. They all responded fantastic and have and still are the strongest support system I could have.
I told my kids one by one.
Do you think you told them differently, but depending on each kid?
For each personality,
Yeah.
probably.
Mm-hmm.
Yeah.
And how old are your kids?
My oldest has just turned 22, and then 19, 16, and just turned 7. So the youngest one, we didn't really even tell him until there was something to see, like surgery. Then we talked to him about what was going on. But the older boys, one by one, I just me and that one-on-one told them individually, which was probably good because then they could talk just to me and they didn't have brothers around and any sort of other distraction. They just felt like they could talk to me and ask me questions. So that was probably the best way I could do that. The rest of my family is so spread out. It was all by phone, and that's not so great.
Because your diagnosis was during COVID as well.
Yeah, well, I mean, my parents live 1,200 miles away, so I had to call them and tell them. And my mom was like, I'm packing now. I'm getting in the car, and we're driving there right now. And I'm like, hold on. just wait. Let's figure this out. Do I need surgery? When do I need surgery? Let's just wait. Don't get in the car right now and drive here. I know you want to. But, yeah, that's how I told my family. So, just one by one.
I've got some grandkids that I wanted to tell. Amelia, our oldest, was 14, and we've always been close. And I asked Tim, our son, their dad, to drop him off one day. And I told him that I was going to tell him that day. And he left him with me, I don't know, for about an hour. And we just sat on the floor in the living room, and we just talked, and I told him about it. And one of the boys, his very good friend's mom had just died of cancer, and so he took it really tough. And I said, Ethan, don't do that. It doesn't mean I'm going to die. It doesn't mean I'm going to be like Nicole. I said, it'll be okay. There's just going to be things different for a while. And I said, there's some things I won't be able to do, and like I can't lift, and I won't be able to do this, and I won't be able to do that, but it'll get better. And we just sat in a big, like the four of them were all sitting there, and we had a little circle, and they all put their arms around each other, and it was pretty great. Until Benny got hot. But no, it was the best way to tell them, and the rest were young enough to where they didn't have to be told, but these were the older ones. And when I said there's going to be things I can't do, then Benny, who was just in kindergarten, said, like what, Grandma, like what? And I said, well, it might be hard for me to plant the garden this year. I might need help. And he said, I'll help you with that. And I said, oh, good, so he did help plant garden, and he came a couple times and picked green beans, and you know what I mean? It was just kind of fun doing those things, with them, too. I'm glad, too, that I had the opportunity to tell them, rather than, hearing it, Mom and Dad are, talking or something. I thought, no, not like that. But it was good.
Our kids were 14, 12, and 8 when I was diagnosed in 2015. And we told them right away as soon as we found out. I wouldn't change that necessarily. There was just, they were young enough, and they knew something was going on. I think for us, and every situation is different, what was so hard is the look of horror on their face, because at the time, my Aunt Brenda, Aunt B, what Beebalite is named after, was right in the prime of her battle with metastatic breast cancer. And so they, right away associated that with me. And I guess as I'm listening to all of us talk, I think when we're telling other people and we're saying, I'm okay, I'll be okay, I'm a fighter, we're probably, we're convincing ourselves as much as anyone. As I'm reflecting on, would I do anything different about that time, and this telling people are a girlfriend's guide, I think it would be hard to change it, because we did what we thought was right at the time. I think also when we talk about our bodyguards and letting other people help us, I'm laughing to myself because I'm thinking, I know myself well enough to know that I wanted to control the narrative. This is my story. We laugh at our house. My husband cries more than I do. He's very, very sensitive. So am I. So that says a lot. He's such a sweetheart. And he could not have carried that burden for me. And so I just knew that was, it was mine. And I think it depends on your situation and your family. Certainly, each person is different and each family is different. But for us, that was a unique circumstance that really weighed on our kids. So there was a lot of tears, all around. And I remember our youngest at the time we talked about things that might happen, and I might have to do chemotherapy and lose my hair, and he said, "So I'm going to have a bald mom?" And I said, "Yes, but it will still be the same mom." And there was a lot of tears shed about that as well. But I think being honest with your family, I think if you have to have those individual conversations with your kids, depending on what ages they are or whatever, it is unique to who each of them is too. Like I said, for our kids, it was appropriate to sit down and have a family discussion. Today, they're 21, 19, and 15. I would sit them down each and tell them differently than I did 7 years ago. So I think as far as advice to other women, it's do what your gut tells you and what you think is right for your family and your situation. There's no wrong answer.
No, I agree with that. My first round with cancer, see, my oldest was 16, my son 14, and my youngest daughter was 6. And so it was a hard age, and they really had a hard time accepting. My husband is kind of like your husband. My husband is very sensitive. He shed a lot of tears. He couldn't have carried that burden. So I always had to tell everyone, I'm going to be okay. I am going to be okay. I am going to be okay. And I fought that until the end as far as being strong. My second round, so my daughter now, she was 30, son 28, and my daughter 20, or something like that. They were like, "We're kicking ass, Mom." It's like, you know what? Not again. And we're going to get it, and I know it's going to be a strong fight, but we're all here, and we're gonna do everything we can for you. And I tell you what, those kids were they carried me through the whole ordeal of what it was, and my husband as well. I kind of knew they'd been through it, and it was like, we're not going to feel this way again. We're mad, and we're going to fight it. So that's kind of what our second time around was with all this. So yeah, they were there for the whole duration of, from the cancer, the biopsy till the end of my reconstruction and my chemo. So after my chemo last June, we all went out to the Green Mill and we all celebrated, and it was great. It was just a wonderful feeling that, we conquered this so far, and we're still fighting. So, yep, absolutely.
Those are great stories. I like how all of it is, you just need to be open, you need to be honest, and you guys know your family more than anyone else, so like you said, Amber, just trust your gut. You know how they're going to want to hear it and the best way that you need to go with it. I want to shift to Corey. You were talking about how, as a provider, you'd like to know how people would like to receive that information, because obviously you don't know what it's like to be on the other end of it necessarily, so it's good to know. So for all of you in the room who've gotten the bad news, how would you have liked to hear it, or what is the best way that you would have liked to receive it?
I think when you have the biopsy, it would be nice if they would just schedule you an appointment. Okay, you're having your biopsy this day. A week from now, you're going to be back here at this time. Whether it's good or bad.
That's a great point.
Have you come in and go through it then. And just then you'd know, okay, I'm not going to have these results for a week or whatever time period it is, and just meet either good or bad face to face and go through it so you can maybe understand it a little more.
That way, if you do have questions, even if it is something that isn't bad,
right,
you could still
know what you
could still say, well, what is it? Why is it here?
Right.
What's going on?
Moving forward, what do I need to
What
look
if we
for?
make you wait a week to tell you it's like a cyst, and you've already
That's
spent
true
that
too,
week
I suppose.
getting your will in order, and you know what I mean? Like,
You
that's
do
a
it.
long week.
Well, you just do anyway. Because
Yeah.
I had an abnormal mammogram and ultrasound once before, and I worried so much through that, so that when I got called back this time, I was like, yeah, it's nothing. But in my mind, it was nothing because I already had that one other time.
And on the flip side, if if they don't have the standard set appointment and they call and say, we need
You
you to
know
come
when
in,
it is
you
then.
know. That's
Yeah, I just say, yeah, there's no good way.
the flip side of that is then you already know they wouldn't be calling me to come in if it was okay, right? So
Yeah, there's no easy answer.
They don't
There's
wait a
there's no
week
good
either.
way. No, I had my biopsy on Friday and I knew on Monday.
Yeah, that's me too.
I struggle with the Friday biopsy result situation. Friday afternoons, when you get those Friday afternoons, do I call you and ruin your entire weekend, or do I just wait?
It's ruined anyway.
That's true.
that's a good point, Judy.
You know, because you're worrying
Yeah.
anyway, so you want to know, I guess. You know.
Talk about
it's,
carrying the burden. What about you, doctor?
Yeah, I'm sure it's.
Oh, it's no fun being on the other end of that phone call, receiving it, but it's certainly no fun knowing that you're about to make a phone call that's going to dramatically change someone's life. Right? Everybody remembers where they were and what they were doing when they get that news, and I have to be part of that narrative. So I try to be intentional with it, but there's just, like you said, there's no good way to give
No.
that news to anybody.
Well, and I know we've talked about in the past how when you're in that appointment where you sit down and you get the bad news, like, people don't remember most of it. The patients just kind of hear the big bad news and then they forget everything else that was said in that appointment. Is there anything that you guys would like to have during that appointment where it could help you kind of think through it or kind of process it a little more?
We give you a binder full of information that's got 6,000 pamphlets
Right.
in it, and we send you out to the parking lot.
Right.
It's terrible. We gotta do better with this.
Yeah,
but
I think
don't know.
always having someone with you if possible. I know it wasn't possible during COVID, but that's huge, as you said. But I personally, just my point of view, I got a phone call that from my doctor up at Abbott. So I received my news over the phone, and just shut down, of course, mentally. But I think it's really simple. You're going to give this news. I guess I would not give too much more information after that, other than we will call you with next steps. If you know they're not, you've said statistically they're not absorbing it, and if they are, they're only absorbing half of what you're even saying, or half was truth, or whatever that number was you said. So to me, it's like, give me the information and let me get out of here. I need to process this. I mean, you have to give some information, but the nurse is going to call and start getting things set up. So
Yeah, that standing around was tough. And waiting for this person to come, or scheduling that, or you just want to get out. You just want to go out to the car and have yourself a ball.
agreed. Simple is good.
Yeah.
Yeah, simple as good.
If you could change anything about what was going on through treatment, with what you did with hair, like your wigs or not wearing wigs, or how you talk to your family, or how you talk to friends who are trying to give you help, is there any big things that stand out to you guys about what you would have liked to change?
I wish I would have been better at accepting help. I always just downplay everything. Like, I'm fine. It's not that bad. I don't need the help. I don't need somebody to make me a meal. And now looking back, I'm like, man, that would have been nice. Why didn't I take people up on those offers? Seriously. The only one thing that I took, and I was kind of forced to, one of my friends wanted to get me a cleaning lady. And at first I was adamant, no, I'm not going to have a cleaning lady. She hired a cleaning lady for me twice a month. She wouldn't hear anything different. And it was the best thing ever.
I love that.
Mhm.
That's a great
Oh,
idea.
good.
There are services in
It
different
was
areas that pay
amazing.
for that for survivors.
Oh, I love that.
Oh,
Specific programs.
it was the nicest thing, and I had such a hard time accepting it, but it was the best thing.
It's a good idea for
Yeah.
someone who might be looking to help a friend going
Yes.
through that too.
Yes, that was
That's for
wonderful.
sure.
So just take the help. People want to help. People feel good helping,
Mm.
and I'm not. I'm good at helping. I love doing it, but I'm not good at accepting it. So
I've said before, if I had to go back and do it, I'm one of the few, I think, that I've met in our group in the last, since we started Be the Light, that has worn a wig. And if I knew 7 years ago what I know now, I would have rocked the headscarf and just went with it. But as we've discussed here, it just wasn't something I could do at the time. But again, if I had known then what I know now, so of course things are easier in hindsight. That's one thing.
Do you feel you were well prepared to make the surgical choices that you had to make? Is there anything that you would want to know more about your surgery, your aftercare after surgery, how it feels in survivorship? What can I do better?
I'm a nurse, so to me, a lot of that, I felt like I understood it maybe on a different level than some people. I think the one thing, and I know you do surgery differently than I had 7 years ago, but when the surgeon that I had told me you will be numb, there's no way you can prepare anyone for that though. So I was happy that she was very blunt about that. I feel like I was prepared, even though again, you can't ever be ready for that. She was very clear and asked multiple times in choosing a single mastectomy or a double and all of that goes with that. So I felt like I don't know how much being in the medical field plays into that or not, and just that I had been around it so much with my family history and my aunts and cousins and everything that had been going through breast cancer, so I'm not sure how much of that was a factor. And you weren't my doctor, unfortunately. But I felt prepared, I guess, for what to expect with drains and things like that.
It's a lot of information to make a really big decision in such a short period of time when you're already going through, you know, the shock and trauma. I feel like it's a really difficult thing to try to explain to people.
I kind of went with my gut. I just kind of went in knowing what I wanted to do, and then after I talked to you, I was like, yep, I just went with my gut. And there was one thing you told me in our first appointment. You said to me, you said, you're going to see your grandchildren. And that, I needed that. Like, I needed that so bad. Yeah.
Good.
So, thank you.
You will.
I think that's what a lot of us don't understand is that the statistics for this disease it's the #1 cancer in the country, correct?
Mm-hmm.
However, it's also one of the most treatable if found early, and I think though, as maybe, I don't know if it's women or just, I assume any cancer diagnosis, your mind goes right to your mortality, and I know from myself, Dr. Sy helping me, my oncologist helping me understand like statistics is huge, and I know I'm sure you do that too, but really, statistically speaking, you know, she said 87% chance that you'll live a long, healthy life. What do I hear? 13.
I don't think I ever thought I was gonna die from, driving home that day, it was was February, so it was early spring. It was a nice day. It was overcast, and the clouds all moved away, and as I was driving, the sun came out, and I cracked the window a little bit because I wanted to smell that nice fresh air, and the sun came out, and I could feel the warmth on my face, and I thought, this isn't the end of it, it's just a kink in the road. And I never thought differently about it, but I never tried and borrow trouble, like in anything, you know, like if you're having company for dinner, there'll be plenty of food, you know what I mean, just trying to keep it on a positive level. I think now I think about it more because I know it can show up someplace else, and that sometimes is like waiting for the other shoe to drop, sort of, but I'm not gonna sit around and wait for it. There's too many things to do between now and then, whatever it is, you know?
I think my issue the second time around was, yes, losing my hair. That was huge for me. I really had a hard time with that. And I have a hard time with body image yet with me for some reason. Getting a rebuild on your breasts, you know, you have a different body image. You're just getting used to everything again, and for me, it's been a tough road for accepting who I am on the outside, loving myself. That is huge for me, and I'm learning how to do that again, I guess, and being more confident in how I look. So I have, with the chemo, I've had a lot of neuropathy in my fingers, and in my feet are constantly hurting. So it's just been, I'm mad about that, but yet I have to live with it, and it's just something I'm learning how to live with and how to cope with, so.
I think people just expect that you're just gonna, once it's all done, you go back to normal. I have a lot of people that say,
Yeah,
oh, doesn't it feel so
exactly.
good to be back to normal? Yeah, there's it's
You
not
don't-
normal,
you
it's a
don't
different
feel-
normal.
It's
you
a
know?
new normal.
It's different.
And so I think that's something, because in my mind I thought, oh, I can't wait to get this over with and get back to normal. And I wish I'd have known more that it was gonna be so much different, you know, not so much, but significantly different. And my fingers still feel funny, your hair's growing back. I got thrown into menopause. I mean, I'll never be who I was last August. And so I think that is something I didn't really fully understand.
So what I hear us all saying is we need that more honesty from other survivors, for people coming after us with this diagnosis to be aware of that it's longer than just your treatment, and that's something that our supporters and our bodyguards, as we're calling them, need to understand too. I know Susan Gersh at the Cancer Center, I remember standing in my driveway and talking to her on the phone, and she said, the next year is going to be really hard, but you're going to be okay. And I, really hung on to that. But really, we talked about it when we did the mental health one last week podcast. It's longer than a year, to your point, Missy, and how do we normalize that so that people coming understand really what to expect? It's not over the day you ring the bell and finish your radiation treatments or surgery. And you are never the same. Good and bad.
Absolutely.
There's a lot of good that comes, and new perspectives that we have with after this trauma that is helpful in the future, but
It's hard though, because you long for the person you were
Exactly.
so much sometimes.
You look in the mirror thinking, where am I?
Yeah, and then you look at pictures
Yeah.
of yourself.
Yeah.
Look at
Right.
last August, I look at pictures and I'm like, oh, I want to be her again. And so it's just
Oh, I
dealing
was
with
so
that,
glad.
I think is.
I think it's as much physical, especially for someone like you who's still, growing out your hair. But when I look at pictures pre-diagnosis, I miss how naive I could be about things. And I was just, just plugging away at life and busy working, mom, etc. But had really nothing too much to complain about. And I miss her. I miss her because she is never coming back.
But sometimes that's okay.
Mm-hmm.
You change through all of this, and you kind of learn that some things really don't matter, and maybe you were stuck in thinking they were the most important thing when they were really the most insignificant thing.
So true.
I think, but getting to that point is a journey too.
I think that you touched on a very important point, that initially there's a lot of upfront support when you get your diagnosis and initially you're going through treatment, and then when you ring that bell and the hair grows back and everyone thinks that you're back to normal and life is normal, and that's actually when the shift tends to happen, and that's when you need the meal train and the cleaning service and someone to clean your garage and
Survival fitness.
and just to tell you that everything, you're still you, and everything's going to be okay.
And the one other thing I wanted to add too is just when you asked Andy about what's something you would tell someone else going through this, or your girlfriend's guide, is find a support system, find a network of people wherever you live, wherever you are. Something like this, something like Be the Light, or a local group of survivors, or start one that you can connect with other people and really have this, because I didn't have the mental health support back 7 years ago. Things have changed a lot since then, and I've been very open about my very extreme depression up to suicidal thoughts, and that's so not who I am. So it was a scary time, and it didn't feel like I had an outlet, a really good, strong, solid outlet. And I've seen now women that are coming through these programs that have been in treatment and saying things like, this has made my journey so much better, so much different, and that's so rewarding to me on the back end to say, I didn't have that, but I'm so thankful and grateful that we could find a way to create it here for you and all of the people that'll be joining our club that we don't want them to be in, but it'll happen. And so I think wherever you are, find a support system that can help you, because there are a lot of people out there who know what you're going through and can, be there with you. And it might not be your family and your friends, but there are other women in the
Even
area
a Facebook group.
Absolutely.
My daughter joined a Facebook group for people whose mothers have breast cancer. How do I help them? There's stuff like that out there. We just have to
That's right.
know to look for it.
There's the blessing of social media
Yeah.
too. Now you can find a lot of that online, so it is really nice.
I would not be anywhere close to where I am without this. You need to know that.
I do. It means a lot.
Yeah.
Thank you.
These are truly some touching words by Missy and the rest of our guests that teach us how important it is to reach out and be a bodyguard for anyone who is in need of some help. We'd like to thank Missy, Judy, and Jackie for coming on today and talking with us. Join us next time when we bring in the husbands to talk about how they were affected by breast cancer. Thanks for listening, and as always, remember to get it off your chest.